When you're on Medicare, it's important to understand what Medicare Part B excess charges are and how they can affect your out-of-pocket costs. These charges occur when a doctor or healthcare provider doesn't accept Medicare's approved amount as full payment for a service. In these cases, you could be responsible for paying up to 15% more than what Medicare covers. While these extra fees might seem small, they can add up quickly. Knowing what excess charges are and how to avoid them can save you money on your healthcare expenses. Medicare assignment is the amount that Medicare has approved for specific services or treatments. When a doctor or healthcare provider accepts Medicare assignment, it means they've agreed to take the Medicare approved amount as full payment for their services. This works in your favor because Medicare will pay 80% of the approved amount, and you'll only be responsible for the remaining 20%. In this situation, your doctor bills Medicare directly, and you won't have to worry about any extra charges beyond your coinsurance or deductible. If your doctor decides not to accept the Medicare approved amount as full payment, they can charge you up to 15% more than what Medicare allows. This extra amount is called a Part B excess charge, and it's something you'll have to cover out of your own pocket. These charges don't count toward your Medicare Part B deductible or your coinsurance, so they're truly an additional expense you might not expect. One of the easiest ways to avoid Medicare Part B excess charges is by making sure your doctor or healthcare provider accepts Medicare assignment before you receive any care. Don't assume that just because a provider accepts Medicare, they also accept assignment. It's always a good idea to double check, even with doctors you've seen before, since policies can change. When you call to book an appointment, ask if the doctor accepts Medicare assignment. This simple question can save you from the extra 15% in excess charges. If they don't accept assignment, you have two options. Either be prepared to cover the additional costs or find a provider who does accept it. In some states, you don't have to worry about Medicare Part B excess charges at all. 8 states have passed laws that make it illegal for healthcare providers to charge more than the Medicare approved amount. If you live in Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, or Vermont, you're protected from these extra fees. This means that if you're receiving care from a doctor within your state, you won't have to pay any Part B excess charges, even if your doctor doesn't accept Medicare assignment. Did you know that certain Medicare Supplement plans cover Medicare Part B excess charges? Medicare Supplement is a type of insurance that helps cover some of the gaps in original Medicare, including things like deductibles, co-payments, and coinsurance. The 2 Medicare Supplement plans that cover these charges are Plan F and Plan G. Plan F is the most comprehensive Medicare Supplement plan, covering just about everything that original Medicare doesn't, including Part B excess charges. However, Plan F is no longer available to people who became eligible for Medicare after January 1st, 2020. If you were eligible before that date, you can still purchase it. But if not, Plan G is a great option to consider. For more information about Medicare, please speak with a Senior Healthcare Solutions Medicare expert today at 866-633-4427. Thanks for watching. Like and subscribe for more Medicare videos.